Good day everyone, I am Jennifer Almadamba, a student nurse from Isabela State University at Tiague campus. Today I will be going to perform ears, mouth, nose, and sinuses assessment. But before that, we need to perform hand washing. Next is to gather all the materials and equipment needed. We have here a otoscope, tuning fork, and a watch with a second hand. Next is to explain the procedure to the client. So, good day sir. Ako po si Jennifer Almadamba, first year nursing student mula po sa Isabela State University at Tiague campus. So, pwede po bang mawang inyong pangalan?
My name is Prince EJ Almadamba.
Kailan po ang birthday?
June 12, 2010.
So, ngayon po, i-assess po natin ang inyong tenga. So, ang purpose po nito ay upang suriin ang mga problema sa tenga tulad ng paghina o pagkawala ng pandinig, pananakit ng tenga o kaya na may mga bukol.
Okay.
So, first, we need to inspect the auricle, tragus, and lobule for the size, shape, pose lesions, discoloration, and discharge. Inspect lang po natin yung auricle, tragus, and lobule. Okay? So next is to palpate the auricle and the mastoid process for the tenderness. Okay. May masakit po ba?
Wala naman.
Okay, so next is to inspect the external auditory canal for the discharge, color, consistency of the cerumen color, consistency of the canal wall, and nodules. Okay, so next is to inspect the tympanic membrane for the color, shape, and consistency, and landmarks. So, inner. Straight lang po yung ulo. Okay. So next is to have the client perform the Valsalva maneuver and observe the tympanic membrane for a flutter. Okay po, ganun po, sir. Wait. And breathe out. Okay. So next is to perform the whisper test by having the client place a finger on the tragus of one ear and whisper 1 to 2 syllable word. So, ganito po. Po. So, I will whisper. EJ.
Narinig ko po.
Ano po yun?
EJ po.
Okay. Next.
Narinig ko po.
Ano po?
Liban.
Okay po. So, next is to perform the Weber test by placing the tuning fork on the center of the head or forehead of the client and ask whether the sound here is better on this side or at the same both ears. So, since the tuning fork doesn't work, so we have here improvise. I'll put it on your head. So, where the sound better po? Both po or at the isang tenga?
Both.
Okay po. So, next is to perform the RNA test by again using a tuning fork by placing it on the mastoid process of the client. And when the client no longer hears the sound, note for the time interval and place it on the front of the external ear. And again, when the client no longer hears the sound, note for the time interval. So, lalagay ko po sa mastoid process nyo dito po. Kapag wala na po kayong narinig na sound, itaas nyo lang po ang daliri nyo.
Okay.
Tapos, ilalagay ko ulit dito po sa harapan ng tenga nyo. Ganun din po, kapag wala na po kayong narinig na sound, itaas nyo lang din po yung daliri nyo.
Okay.
Okay? Okay. So, next is to perform the Romberg test by having the client stand with feet together, arms at the side, close eyes for 20 seconds, and observe for swaying. So, tayo po tayo. Okay po. Feet, harap po tayo dito. Feet together, arms at the side, close your eyes po for 20 seconds. Okay po. Start now. Okay, thank you po. Next is to assess the nose, mouth, and sinuses. We have here the gloves, gas pads, tongue depressor, and a pen light. So next is to explain the procedure to the client. So now, sir, we will now going to assess your mouth, nose, and sinuses.
Okay.
Okay? So first, we need to inspect the lips, observe for the color and consistency. Next is to inspect the mouth and teeth by asking the client to open their mouth. Note for the number of teeth, color, and condition. Also, we need to take note for any repairs such as crowns or any cosmetics. So, sir, open your mouth. Okay, so say E. Okay. So, next is to ask the client to bite down as though chewing on something and take note for the alignment of the 10 alignment of the upper and lower jaw. So, sir, kunyari po may kinakagat po kayo, ganito po. Ganito po. Okay, so next is to put on gloves and retract the lips and cheeks of the client to check the gums for its color and consistency. Okay, sir, I will be your lips. So next is to inspect the buccal mucosa using a pen light and a tongue depressor to check for its or inspect for its size. Okay. Also take note on the Stenson's ducts. Okay. So next is to palpate and inspect the tongue of the client. So, okay, I will palpate your tongue, inspect your tongue. Okay, sir, say ah. Ask the client to stick out the tongue. Okay. Note for, okay, sige na po, okay na po. So, next is to assess the ventral surface of the tongue. So, say ganun by ask the client to stick out the tip of the tongue on the roof of the mouth. Ganun po. Sa sa tuktok po. Okay. Hindi po sa taas po. Ganyan po. Okay, so okay na po. So next is to assess the inspect for any Wharton's ducts. So again, ganun po yung okay. So next is to observe the sides of the tongue by using a gauze pad to hold both sides of the tongue. So we'll be using a gauze pad. So sir, I will hold your tongue po. Move your tongue out. We also need to palpate the sides of the tongue. Okay, so okay na po. So we need to discard this properly. Okay, so next is to check for the strength of the tongue. So in checking the strength of the tongue, I will be putting my finger on the client's cheek and ask the client to press the tip of his tongue on the finger inside his cheek. So, ganito po. Dito po. Okay. Okay. The other side po. Okay. So, next is to check the tongue's ability to taste. So, we have here, I will be using again a tongue depressor. And okay, so say sir, ano pong lasa?
Maalat.
Okay, so next. Okay.
Matamis.
Okay. Okay, so next is to inspect the hard and soft palates and also the uvula. So, wait, pusog po kayo, sir. Front po, tapos taas po. Okay. Baba niyo pang dilo nyo. I will be using a tongue depressor. Okay po. Relax lang po. Okay. Sorry. So, next is to, yes, note for that. Next is to inspect for the uvula. Note for its characteristics and openings. Okay, sir, again. Say apo. Ganun po. Apo. Hindi bag apo kayo. Ganun po. Again. Okay. So, next is to inspect for the tonsils we need to note for its size, shape, and consistency. Also, note for any presence of exudates or lesions. Again, I will be using a new tongue depressor. Next, kahit huwag niyo na pong stick out yung tongue po. Okay. Ulit po. Okay. So, next is to inspect the posterior pharyngeal wall. Note for the presence of any exudates or lesions. Again po, ganun po tayo. Okay. So, next is to, before assessing the nose, discard the gloves and perform hand hygiene. Okay. So, in assessing the nose, we need to inspect the external nose, inspect and palpate the external nose. Note for its size, shape, and consistency and tenderness. So, sir, I will be inspecting and palpating your nose. Okay, so next is to check for the patency of air through the nostrils. So, sir, ganito po. Akulod po natin yung isang ilong. Tapos, sniff po. Singa po tayo. Okay, so sa kabila naman po. Singa po. Okay. So, next is to inspect the internal nose. So, I will be using a otoscope. Using the non-dominant hand, tilt the head of the client. So, sir, tilt po. Next. Okay. So, now we go on to the assessment of the sinuses. So, in assessing the sinuses, we need to palpate for the frontal sinus of the client. So, here, using the tongue up. Okay. So, next is also palpate the maxillary sinuses of the client. So, next is to percuss the frontal and maxillary sinuses. Next. Okay, so next is to trans-illuminate the frontal sinuses using the pen light. And we need to darken the room. Okay. First, okay, so next, the other one. So next is to also trans-illuminate the maxillary sinus of the client. Sir, open your mouth po. Okay, next po. Open your mouth po. Okay, very good.